Hi, this is MK and you're watching an Apta Institute presentation. This video presentation is about disc displacement disorders in the temporomandibular joint. However, in order to understand what disc displacement disorder is actually about, let us first, in this first part, brush through our anatomy, familiarize with all the structures around the temporomandibular joint and disc related, and let us look at the biomechanics of the movement, which again involves the disc. The temporomandibular joint has two bony components. One is the cranial component, which is the fixed component and which is represented by the temporal bone, and the mandible, which is the movable component. Now, the temporomandibular joint is similar to any other joint in the body except for an unique feature, which is it has another articular component, which is the occlusion. It is how the upper and the lower teeth come together and occlude to stabilize the temporomandibular joint. So when we're dealing with temporomandibular disorder, we need to take this into consideration because it has two of these features. So this is the only synovial joint in the body which has a teeth on it. So when you look at the lateral view from the side, you have the temporal component and you have the mandibular component. And when you look at it more closer, we have a convex mandibular head and a concave mandibular fossa. And the joint and the temporomandibular articular component doesn't stop there. Then you have again another convex articular eminence. And the disc will be located in between this joint, and you have the auditory meatus here. So when we look at it closer, we have the disc in between the mandible, the mandibular fossa, and the articular eminence. Now the disc is actually made up of three regions. One is the posterior region, the second, the intermediate, and the anterior region. Now when we look at the posterior aspect, the disc is attached by a ligament, or it's known as lamina or the retrodiscal lamina. As an extension, the superior part gets attached to the temporal component around the mandibular fossa, and then you have the inferior part of the lamina which attaches to the mandibular component. Now this area here is highly irrigated and highly neural. It's innervated, highly innervated and highly irrigated. So the vascular structures and the neural structures are quite in dense proportion in this region. And when you look at the anterior part of the disc, you see that the lateral pterygoid muscles superior head gives some attachments to the anterior portions of the disc and also towards the mandibular head, while the inferior head of the lateral pterygoid muscle gives attachment towards the neck of the mandible. Right. So when we look at this, is in a close pack, close pack position. When you look at the position of the disc, now throughout the movement, the disc and its relationship with the condylar head will be maintained. Now that is called the centric relationship. So what is the centric relationship is the apex of the condyle will always be at the position of the posterior band. That's the apex, right? So the apex will be at the posterior band, and the superior anterior portion of the condyle, the superior anterior portion of the condyle will be always facing the intermediate zone. So when we look at the disc positions during temporomandibular mouth opening and closing, this centric relationship between the mandibular condyle and the disc will always be maintained. It is when there is a disruption in this relationship is when there's a we can identify it as a disc displacement and all other disorders. So when we go through those mandibular movements, we'll be able to appreciate it much better. Right. So again, here, this is a cadaveric view, and you can see that the apex is always around the posterior band, and then you have the superior anterior portion of the condylar head on the intermediate band. So this is the intermediate region, the posterior region, and the anterior region. So the anterior region is attached by the superior lateral pterygoid over some portion of it on the disc and some portion on the mandibular head. And then you have the inferior lateral pterygoid over the neck of the mandible. And these are all the retrodiscal structures of the posterior aspect of the temporomandibular joint. All right. So when we look at the anterior view or in the front view, now the disc has to be held by something. So it has to be held in place by something. It's not just a loosely thing which can travel here and there. So it is held medially by the medial discal ligament and laterally by the lateral discal ligament to keep the disc in positions even during movements, so that it doesn't slip out laterally or slip out medially. So if you look at the cadaveric view, so this is the medial pole of the condyle and the lateral pole of the condyle. So you have the disc there, and then the discal ligaments around here to attach to both sides, the medial and the lateral disc.